As winter brings a rise in respiratory illnesses across the Midwest, staying well and out of hospital has never been more important. Joining us today is Carmel McInerney, Respiratory Advanced Nurse Practitioner at Ennis Hospital, who's urging people to take simple, practical steps to protect their lung health in the coming weeks. Very good morning to you, Carmel.
Good morning, Alan. How are you?
Very well. Thanks very much for joining us. And this is particularly on such an important issue. You're highlighting that quite a number of respiratory-related hospital admissions are preventable. So what are the most common issues bringing people into hospital at this time of year?
I suppose the most common issues are flare-ups of their asthma, COPD. Any underlying chronic condition is going to be more susceptible to be exacerbated during these times, because as Christmas is only around the corner and there's always festive gatherings, and unfortunately that does bring a rise in respiratory illnesses. I think last year in the Midwest region alone there was 1,200 presentations to the hospital with respiratory illnesses.
It's just that time of year, isn't it? I mean, you've got the amount of people I know who've had flu and other things like that. So
exactly, and mention on the flu, there is a rise on the flu, as we know, in the community. So it's really important to take practical steps.
And as we say, winter can bring triggers like cold air, damp conditions. What practical steps, Carmel, can people take day to day to protect their lungs as much as possible?
I suppose number one would be the vaccination, the flu and COVID vaccine. You get 40-60% of immunity when you do take the flu. And because flu is on the rise, I think up to yesterday, I think there was 816 patients in hospital with the flu. So, and most GPs and pharmacies across the country are administering vaccines. And if you do want to find out where you can get the flu vaccine locally, you can just go onto the HSE website and look for the vaccine locator. It's never too late to get your vaccine. And I think that would be the first and utmost important thing I would recommend. Secondly, I suppose something very simple is knowing your triggers. Let's say you know that you going out to the cold air is going to increase your risk of a cough or breathlessness. Then a very simple trick is just to put a scarf over your nose and your mouth, and that warms the air as it's filtered into the lungs. Another one is, I know the weather is not appropriate for hanging out clothes on the clothesline, but we would discourage people from drying clothes on the radiators, because this is going to predispose to the production of mould, and mould can be a trigger. So if you know your triggers, then you can avoid being triggered by these triggers. Okay,
those are good points. And I guess staying on top of your medication is important as well, Carmel. I'm thinking, if you have asthma, inhalers, prescriptions, how important is that, and what should people check, and how can pharmacists or GPs help in that regard?
Absolutely, medication and staying on top of your medication is really important. And I suppose when people feel well, sometimes they don't take their inhalers, but we as respiratory professionals would be encouraging to stay on your medication when you're well, because there are generally preventative medication. Make sure your prescription is up to date, especially coming close to Christmas now, with GPs and pharmacies not open their extended opening hours. But making sure you have the medication in. And if you're feeling unwell, ask a caregiver or a family member to go to the pharmacy to pick up your prescription. If you're in doubt about any of your medication as to how often you're to take it, or unsure of how to use your inhaler, the most important thing to do is pick up the phone, ring your respiratory team member or the pharmacy or your GP, and they're always at the other end of the phone to advise on medication.
We do want to avoid unnecessary or preventable hospital admissions. However, the flip side of that is you don't want people waiting it out if there are warning signs. So what warning signs should people never ignore, and when should they seek medical advice rather than putting it on the long finger and waiting it out?
We would always suggest and emphasise to patients, like if the early symptoms, because managing your symptoms much earlier leads to better outcomes, as we know, especially crucial for anybody with a chronic disease like asthma or COPD. So if you notice anything unusual about your breathing, with worsening breathlessness, a cough, a wheeze, loss of appetite, high temperature, they're all warning signs that your condition is not the same as what it was last week or the week before. So we would say contact your GP, and out of hours make sure you contact Shannon Doc.
Okay. And just finally then, in terms of supports that people should seek out, or programmes, be it if they want to stop smoking, smoking cessation, obviously a big part of this. I know there's HSE Quit Midwest. People can find details online for that. If you have COPD, asthma, what kind of longer term supports are available to help people manage their health and stay active?
Okay, in relation to their asthma or COPD, if they need early intervention, they are specialised intervention, they can contact their GP, and the GP can refer them to the GP access clinics in the integrated care hubs in Clare, Limerick and Tipperary, and they're run by physiotherapists and nurses in the community. COPD, exercise. There is a pulmonary rehabilitation programme, which is an 8-week course that involves exercise and education by healthcare professionals. And again, GP and respiratory consultants and teams can refer to the integrated care hubs for that one. We would really emphasise social connection for patients with a chronic condition like COPD.
Okay.
So you have a Leaving Well programme, and the contact details of that are on the HSE website as well, and they're all accessible locally. Clare COPD support groups, again, they just contact copd.ie and you'll be able to access the support groups.
Okay.
In terms of quitting smoking, the HSE Midwest Quit programme, they can contact the local support here. I can leave you the contact details.
Yeah, and we can give them out later on in the show. We do have to leave it there with Carmel McInerney, Respiratory Advanced Nurse Practitioner at Ennis Hospital. Thanks for making the trip in to see us this morning with a very, very important advice.